It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. Today I have an email from Maria who says, "Hi Patrick, it feels like I'm not having a say in my husband's care when I think that things are not being done properly in ICU. He has been on the ventilator and I see that he has pneumonia infections as well as MRSA, pulmonary embolism, DVT, a gallbladder infection, and the list goes on. They have not tried to take him off the ventilator and on a BIPAP, but they're telling me that his setting is at 35 to 40%, that he's breathing mostly on his own, 18 breaths per minute." Well, I'm glad you're reaching out, Maria. And the thing is, if he has a pneumonia, he might need the BiPAP, right? Because what the BiPAP does, it helps him expand his lungs, right? And that will help with pneumonia, assuming they're targeting, with the right antibiotics, antifungals or antivirals, depending on what level of infection. Yes, it says MRSA. So he might be on vancomycin for the MRSA. Also, if he's got a pulmonary embolism, he might need some heparin, he might need a heparin infusion, right? That might also compromise his cardiac function as well as his breathing ability. So it might be justified at the moment that he's still on the BiPAP. Now, the question for me is this: is he on a BiPAP with a breathing tube or with a tracheostomy or just with a BiPAP mask? You haven't shared that yet. So, the devil is often in the detail, and the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. So the problem here is that some things are unclear, and they're probably very unclear for you as well. You haven't probably asked the right questions as yet. If he has a gallbladder infection, most likely he's also needle by mouth, right? He can't have any nutrition for that, potentially, and he might need some TPN, total parenteral nutrition, or intravenous nutrition, right? It really depends on how they're going to treat the gallbladder infection, right? So there's a number of issues here, and him being on the BiPAP might just be what he needs for a few more days, because that will help him with pneumonia. Because pneumonia often means there's collapsed parts of the lungs, and that will help. The BiPAP will help open up those collapsed parts of the lungs whilst clearing up the pneumonia, hopefully with antibiotics and so forth. Now, it looks like he's got a number of issues: DVT, pulmonary embolism, that goes hand in hand. Both are, caused by blood clots. And like I said, he's most likely on a heparin infusion. So also with the BiPAP, he should have some arterial blood gases to see whether the BiPAP is actually helping him with a good gas exchange, i.e. if his O2 is up or PCO2 is down, right? So, there's a number of things that need to be looked at. Also, what does his chest X-ray show? Is the chest X-ray clear? Is it clearing up? Those are very, very important questions that you need to ask. What is his oxygen saturation like? Can he cough? Can he cough up his secretions? Does he need some suctioning? And like I said, is the BiPAP being delivered with a mask, with a breathing tube, or with a tracheostomy? That's what it comes down to here. So I hope that helps and answers your questions. I have worked in critical care for nearly 25 years in 3 different countries, and I have been consulting and advocating for families in intensive care since 2013. And you can verify the work that we've done on our testimonial section. We have saved many lives with our consulting and advocacy. I have also worked as a nurse manager in intensive care for over 5 years prior to starting my own consultancy and advocacy practice here at intensivecarehotline.com. And we have also done some client interviews at intensivecarehotline.com. If you look on our membership link, if you look on our podcast link and video link, we have done client interviews who verify the work that we've done for them, where we've saved lives as well. And that's also why we created and started a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded that will help you to make informed decisions, have peace of mind, control, power and influence, making sure your loved one gets best care and treatment. I also do one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. I talk to you and your families directly. I talk to doctors and nurses directly on your behalf, and I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one in intensive care. And all of that will help you to make informed decisions, have peace of mind, control, power and influence, making sure your loved one gets best care and treatment. You can't afford getting this once-in-a-lifetime situation wrong when you have a loved one critically ill in intensive care. You can't leave things up to chance. And that's exactly what we're here for you to do. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send an email to support@intensivecarehotline.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show. And you will get notification for the YouTube live if you're a subscriber to my YouTube channel, or if you're a subscriber to our email newsletter at intensivecarehotline.com. Thank you so much for watching. And if you want to leave a small donation here, the super chat YouTube button, that will help us to make as many videos for families in intensive care and help as many people as possible. If you want your email read out quickly and have your questions answered, leave a small donation, and then I will get to it as quickly as possible. I have so many emails sitting in my inbox from as late as last year even. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.